Okay, our next presenter is going to be virtual, but he'll be on to answer questions at the end. He's going to speak to us about really how do we mentally handle and manage our life interrupted by hypoPARA. Dr. Matt Webb is a licensed psychologist, and his daughter actually has hypoparathyroidism. So we welcome Dr. Webb.
Thank you for the introduction, and welcome to my presentation. I'd like to thank the Hypoparathyroidism Association and Michelle and Patty in particular for all of their help in getting me aware of this possibility. I have no disclosures to make. The focus of my presentation today is going to be on the intersection between health and psychology, and specifically to think about ways that individuals with hypoparathyroidism have unique challenges related to mental health, and to think about some ways to find solutions or ideas for how to live a more well-rounded life. So I'd just like to share a little bit about me. So my experience most recently has been in rehabilitation psychology, and this is a specialty subfield of psychology that focuses on working with people who've had some kind of disabling or debilitating condition, primarily neurological. So people who maybe have had Parkinson's or long COVID or concussion, ALS, and helping with the adjustment process, trying to figure out how to still live a full life, as full a life as possible, a good life in spite of the health challenges. And so that's a little bit of my background and why Michelle and Patty thought that I might be a good presenter for the conference. But I also have a very personal connection to hypoparathyroidism as well. That picture is my daughter, Mabel, and she was diagnosed with hypoparathyroidism about a year ago after she had a seizure and was in intensive care for 4 or 5 days. Well, our calcium level was getting raised up, and I remember at the day when we finally got the okay to return home, her levels were high enough where that would be an okay thing to do, that I asked the doctor, okay, what are the, she's got this condition, and certainly there has to be some restrictions or guidelines or things we need to do aside from following up with endocrinology. And the doctor said, oh, no, she can go back to school and play, and yeah, it should be fine, don't worry. And I thought at the time, yeah, there's probably more to the story. There's probably a lot more that is going to have to be figured out to manage her care in the long term. And I was definitely right about that. So I first want to talk about the conceptualization, or the way to think about anything that is as complicated as hypopara, because we're talking about something that is physical, but it has more to it than that. And I wanted to share a quote. There's a 2-part quote. The second part's at the bottom of the slide, but I'll just read off the first part. And it's the following. My long-term health conditions are biological in origin, but the impact has been felt physically, psychologically, and socially. My long-term health can't be treated by the biological model alone. And then the second part is on the slide. The medical support keeps me alive, but it is the psychological and social support that enables me to live. And as you can see on this slide, there are different components, and they're all important, relevant components to anyone who has hypopara. There's the biological part, which everyone knows about in this most of the conference was discussing, the effects of uh, no parathyroid hormone and the supplements you have to take and the impact it has on you and the doctors you have to see. And for a lot of people, that this is just part of multiple conditions that you're having to live with. And the psychological part, I'll of course be talking a lot about uh, during the rest of my presentation today. The social part is huge as well, in terms of how somebody experiences and goes through the process of having this condition. So what are the hobbies? Can you still do them? Do you have to curtail them? Do you have family support? Are you isolated? Do you have connections, church or community connections, money? Do you have enough to buy supplements and to maybe see providers that aren't covered by insurance, or you're underinsured? And so all of this adds to it. One thing that is a combination that I think is important between the psychological and the social impact for hypoPARA and for a lot of people who have their life changed by a health condition is that the identity can change, that the things you used to do and the freedoms you had before having this condition might affect your energy levels, your ability to travel, your ability to if you're the go-to person and you're used to being the go-to person for everything, maybe you have to curtail that back. And other people may not understand. So it can change relationships, it can shift roles, and that's a lot to adjust to. So going to the more psychological part of it and how people might respond or how anyone responds on an individual basis, I want to talk a little bit more about some of the complexities that are unique to hypoPARA that make it a challenging condition to live with, or can make it a challenging condition. There's the events that lead to the diagnosis. So these are things like you could have heart failure. Like in my daughter's case, she had a really bad seizure. And for people who diagnoses in the emergency room and hospital, and they get treated for a seizure disorder, and that's a nightmare. And the rarity of this disorder, as everyone is of course very well aware, creates this gap in knowledge and puts a lot of the burden on developing your own expertise on how to not only live and stay alive, but to thrive while having hypoPARA. And that's a huge learning curve. And I know there's a lot of things we've brought up with my daughter's endocrinologist that he might have been aware of, but it might have been after maybe something got to a point where it was a problem. So thinking about like being proactive with kidney health and, all the different ways that managing hypoPARA can be complicated may not be initiated by provider. They may very well not know what the next steps are, or what to think about or consider. And then there's the way that health conditions draw your attention to how you feel. And under normal circumstances, people go through a variety of different physical states where they don't feel good, or they have a headache or stomach ache, tired. And so most people have the luxury of brushing that off. And I remember with my daughter, before she had hypoPARA, anytime she was off, we would just be like, a lot of parents, buck up, it's time to get to school, get out of bed. And now it's shifting the focus where we're having to think about like, oh boy, it's been a while since we've had a blood draw, and could this be calcium related? Could it be this? Could it be that? And so it changes your focus. it doesn't give you the luxury of assuming that you're all good. And this is especially true when there's times where you might be going along and things are smooth, and then if you have like a bad bout of a GI bug, then you're not able to keep calcium down or anything like that. Then you're having to think about, oh boy, are the numbers going to really plummet? Is there going to be some kind of detrimental issue that occurs? So there's this looming threat. And so what this can do is really the sequences of whether it's social changes, your felt sense of yourself, your identity, your ability, the focus on your body and what's going on with your body, and just trauma. If you've been traumatized by the experience of being shocked by having hypoparathyroidism, that it can almost corner you into having poor mental health. And it can be done in, I didn't come up with a comprehensive list, but there are 3 areas that I think would be more areas of susceptibility. One is just that simple experience of being traumatized or feeling anxious about your health and worried that something bad is going to happen. And there are different ways that you would know that this is a problem or something that is a struggle. One is just simply that in the problem category, the first dash I have is autonomic activation. And what that means simply is that your cardiovascular system is gearing you up for something to happen. So it could be, your blood pressure's up, or people experience it as stress, that you're more worried, or there's other parts to it as well. But just that feeling of being more tightly wound, and that of higher stress. And if that's one of the problems, or one of the ways that it's being experienced, then one way to get out of that particular problem area of feeling that sense of tension or stress would be to find ways to regulate the autonomic nervous system. So this could be things like deep breathing practices, going on a walk, being by water, spending time with a pet. These are all really nice ways of regulating yourself, or being around people, friends or family, that are calming and comforting. And the list I'm making isn't comprehensive, but intended to just generate maybe some ideas. And if there are any symptoms that I'm mentioning now, that maybe some ideas of things to try to kind of spark some ideas about some solutions. So the next item on my list is intrusive recollections. And this is more specific to post-traumatic stress, where you have memories of something, some aspect of what happened that, or negative expectations, the expectation that something bad will happen, and those are intrusive. So you think about the hospitalization, or you think about when things were at their worst. You think about the future, and you think about, well, what if this, what if that happens? And you begin to ruminate on that in some way. That there are specific therapies that are designed to help, especially with those intrusive recollections. So on the solution side, there's the ART, the ART, or EMDR therapy, and I'll talk about those um, a little bit more. So those are acronyms, and if you're looking for counseling, a lot of therapists will advertise that they're trained. ART stands for Accelerated Resolution Therapy. EMDR is eye movement, desensitization, reprocessing. Usually people just put you don't have to memorize the acronyms. Most professionals will just put if they're trained in that specific modality. So they'll put ART or they'll put EMDR. If you go on their website or if you call an office and ask, are they trained in one of these therapies? And these are like time limited, maybe 5 to 10 sessions where they focus on reprocessing a traumatic event or a traumatic experience, one that you can't get out of your head without feeling distressed, without feeling upset. And they go through it until it's not like you forget that it happened, but the intensity, that emotional intensity is gradually fades away. So those are very helpful therapies for trauma. And there are other therapists that also specialize in trauma that do excellent work as well. If the way that that you might be feeling, going back to the problem, if it's not that, but maybe there's avoidance. So avoidance of, and this might be more anxiety related, that you find yourself not wanting to do things, that things seem more stressful or more anxiety inducing, that you might be concerned about your health, understandably, and so there's certain activities that you're a little uncertain about trying, or whether that's traveling or exercise related. And especially if you get the clearance from your numbers are good and you get the clearance from your doctors, but you're still just kind of stuck because you get too anxious when doing things, or with the obsessive tendencies that you find yourself just worrying a lot about your physical comfort and your health. There are different solutions to that. Therapy again can be helpful. Doing new things, having experiences and having them go well. I've talked to people all the time where they're anxious and they're not sure, but they're invited to a party, might be a small gathering, and they kind of make themselves go, and they go and have a really good time. And so that becomes a positive experience, and life's to be lived. So having, anytime there are opportunities to do things and enjoy life, it's a shame when the stress of it can prevent that. So I want to go to the next kind of area now, that a problem area, which I'm more familiar with from concussion, people who've had concussions, or long COVID or other health conditions that cause brain fog. But I'm assuming a lot of the same principles still apply. And some of those things that I've become aware of in my time working as a therapist is that some people have different ways that they experience brain fog. And there's the symptom itself, but then there's also the psychological emotional response. So thinking that some people have told me, like, I just don't feel as smart as I was before. I'm not as sharp. I feel dumb when I can't come up with whatever. And it's like, these people are very intelligent and many times still working and still central figures in their lives, and no one from an external perspective would consider them to be that way. But internally there can be those thoughts, and along with that a fear that especially during times when the symptoms are especially bad, that they won't get back to even like a new baseline, that things will just keep getting worse and worse and worse. And so when thinking about ways to consider what to do with that, that there of course needs to be symptom management. That if if you're driving and you have that brain fog and you don't feel safe, you have to pull over. If you're going through, I'm sure a lot of people at this conference had to do symptom management with what presentations to go to, and resting afterwards, or trying to figure out how to pace so that you don't overdo it, and how to get those symptoms to get knocked down a little bit, whether that's through rest or through whatever means possible, clearing your head, going on a walk, whatever helps bring some greater sense of mental clarity. And then for the symptoms that can't be managed, and you just have to know that it's there and it's something to experience, that there's also a difference between that symptom and having to endure that symptom, and the suffering that is felt when you have that symptom. So the symptom is bad, but when you suffer, when you feel like on top of the symptom, you're thinking, I'm missing out on life. I should be doing better than this. All of that psychological meaning that is added on top of the actual symptom oftentimes creates what creates the suffering, or the feeling that you're suffering. I see this a lot with pain. Pain is a big one of these, where a lot of people who deal with chronic pain talk more about the suffering being the feeling of missing out, or the feeling. It's not the symptom of pain itself that's the worst thing. It's what it represents. So that could require some work and some reflection, and we'll talk more about some strategies that could help with that. So the last category, and again, this is not comprehensive, but people could feel depressed, and whether that's due to a lack of PTH or whatever it's due to, that people feel depressed in different ways. They can feel stuck. You can focus on the negative things. I can't, eat the same way I used to before. I can't do the same activities I did before. Hopeless, that, I'm not going to be able to fulfill any dreams or have a meaningful life. And another way that people can feel depressed is lacking resources, that I'm depleted. I don't have what it takes. Other people can't help me figure it out. So all of those experiences of depression, and it could be one or it could be all the above, can get somebody in that state where it can be really difficult to get out. So some just again, to kind of spark some thinking around this, that sometimes just getting moving and getting outside and going on a walk can be a really great way to change your mood. To focus on uplifting things. So to go to a park and watch children play on a playground, and see how they do so effortlessly, and who's in the lead and who's following, and what games they're playing. And that can be a nice way to get out of your own experience and focused on something outside of you that lets you know that life is still going on and there's still joy in this world, and that maybe you can feel some of that as well. And of course, no one can forecast the future. And so the thoughts around, I'm never going to, or I'll never, there are some things that might be true, but there are undoubtedly lots of opportunities. And when life closes a door, it can open up a window. And you just don't know what other things are available, especially if you're focused on the closed door. And the last one I put down here for the solution is more about like resources and trying to get more resources and support. And one of the things in talking with that I've heard just a lot with people who have chronic health conditions is that it seems like their providers are getting, they kind of get used to the symptoms, and it's more of like just a familiar thing, like, hi, how are you? Oh, okay, you're tired, and okay, you're, this, and you're that. Okay, so that's about the same. And it has this kind of automaticity to it. And there might be some problems that are really getting to you that you want some resolution with. So when I put down here elevator pitch, it's the idea that if you have a specific problem you're wanting to get some traction with, to figure out how to phrase that problem in a way that you could explain to somebody on an elevator ride. So I have hypoPARA, and one of the things I'm wanting to get in front of is potential, kidney disease later on in life, because of the cumulative effect of calcium, the calcium intake. So that's a specific problem, and it's very succinct. And if it's made direct with a provider, or if you see a new provider, that really orients them that this isn't just a automatic like dance where you're, kind of going through the steps, but something that is of specific importance to you. And you might have to seek another opinion or a different provider, because the first provider may not really have any good ideas, or ideas that match how important the problem is for you. So other resources that might be needed or might leave you feeling less like you're depleted and you don't have any support could be through social services, social workers, nonprofits, especially if you need additional money to pursue different treatments, or you have different health needs and you need to adjust your life and need some help navigating those adjustments. And this conference, the last item, this is to maintain connections from this conference. I hope everyone got to meet one or two people at least that they're able to share ideas with, and maybe share phone numbers or email addresses with, and that by maintaining those connections, it really is so important, especially with a rare condition. So I just wanted to mention a few other resources from the purely treatment side of things, therapy-wise. So this slide is, I did a screenshot of part of the link that I have on this slide. And I mentioned that I have the rehab psychology background. There's also a related field, health psychology, and they do very similar things where they understand the confluence of health and psychology, and they would understand the challenges and not assume everything that's a problem is related to a childhood trauma. Maybe it is, maybe it's not, but they would get the whole picture, not just look for things that are unrelated to your health. They'll understand that your health is a big part of your life. And this is, you just put in the location and what you're looking for, what they're board certified in, and then hit search. And so that's a good resource. Another discipline that tends to cater more towards individuals with medical conditions is medical hypnosis, hypnotherapy. A lot of providers focus on stress reduction, some somatic symptoms, gastrointestinal symptoms, tension, pain. My daughter, we use some hypnotic techniques when she had a needle phobia after she was poked so many times in intensive care. She was really frightened to get more blood draws. So there's a technique where you can lessen the sensation on your skin and when you're getting a poke, and it really helped her. So that's a really good resource as well. And this is a similar kind of deal where you put in your location and the specialty you're looking for, and they'll route you to people who have some specialty in that area. So this quote, "Those who have a why to live can bear almost any how," is really profound and has been used quite a bit. And that's the part that I'd like to leave everyone here with, that there's a lot of strategies and a lot of things that have been covered in this conference. And so, but underlining it all is a purpose. And I'm wondering what your why is. Is it a pet, children in your family? Is it nature, a higher power, cause that means something to you? And especially if you can't come up with one or a few things that give you a why to live for and a why to keep pushing, I encourage you to seek support in finding one. Life is too precious, and everyone with hypoPARA I know has worked really hard to keep their lives, and finding a way to honor that is so important. So that's the end of my presentation. I'll be around live to answer some questions. So now I'd like to turn it over to the moderator. Thank you.
All right, what a great presentation. We'd like to welcome Dr. Webb to our Q&A session. We have a couple questions that came in. Hi. Thank you so much. It was wonderful. So we do have a couple of questions for you. We're going to start with Michelle, and then if we have any in the room, we'll go there.
Sure.
Okay, the first one that came in online says, my main avoidance problem is the fact that I've been ghosted by both my doctors and I feel like the insurance system. So I now put off making appointments because I just feel traumatized by the healthcare system. Do you have any recommendations how to get over this?
Yeah. I'm sorry to hear that, first of all. So I think, without getting into specifics in terms of what the kind of how you've been ghosted, I think there's probably, I think about that resources bullet point that I included, where I'm guessing if, a lot of people at this conference have gone through pretty similar things both with the providers and with insurance, and not getting the kind of response that you need to help you move forward and taking care of your health. So, the suggestion I think would be to try to cleanse your palate as much as possible, whatever that might be. And again, that could be through, therapy or your own mindfulness practices, and believe that if you're going through it, other people are going through it as well. And, this is, the power of the collective is what this conference is all about. And, united, you can do a lot. You can overcome, all kinds of obstacles. So I've been really impressed with the conference and how that's been a major takeaway for me. So just believe in that.
Okay. Bob, did we have any in the room?
Are you familiar with Rosebud, the AI counseling app?
I'm not. No. Is that one that you've used before and can recommend? There's some other apps that I'm more familiar with that are more like recordings of relaxation and other kinds of, audio clips that you can listen to help with stress reduction. Tell me a little bit more about, is that Rosebud a helpful one, or do you know much about
I got it when it was
it?
in beta. It still might be in beta. And recently,
Okay.
a while ago, they upgraded to Bloom, and I'm paying less than 20. I think I'm paying between 10 and less than $20 a month for it. And it is so good. I mean, I should get up and
Okay.
do it every day. I say I'm going to do that, and then I don't. I just talk to it occasionally. But it's so insightful. And I mean, you're trained as a counselor, so you know how to listen and say all those stuff, but you can't talk to your friends, or you can't dump that crap on them. You won't have your friends anymore. Maybe once, but it just listens and it finds patterns, and I like it. And I mean, I was in improv for a while, and they said we were supposed to read The Artist's Way, where it talks about every day you should write like 4 pages of just like a mental dump. And I need to do that as a discipline, but like we go to art therapy every week, and then I'm old enough to be a senior, and the same day we go to the senior center and we make some project, and it's art therapy, but the only thing they do is they ask your word coming in and going, and it's like talking to your friends. And then I also, for the last 4 years, I keep getting passed along from one student counselor to another. And it's free. And I have one who's really good this year. Her husband is dying of esophageal cancer, so she gets illness like other people don't. So I have so much access to stuff, but I've just noticed how it helps. And I need to get, now that I'm on a clinical trial and I've leveled off, so I need to get all those disciplines in place where every day I do this just for my own well-being, like a self-care. But I really like it when I use it. But I was just wondering, as like a counselor, if that's like threatening to you. And I guess the other thing I wanted to know, and you don't have to answer this if it's too personal, but is it super hard on you that you studied and learned all this stuff, and maybe it's providential that you knew before this happened to your doctor, but it's got to be triggering to have your own little child. And a lot of us, we were like in our 40s when this happened, but to have it happen to a little innocent kid, that's got to be triggering for you too.
Yeah. Well, there's a few things that you mentioned that I'll respond to. So a couple of things that I really like that you are doing quite well that you mentioned. One is that you found a variety of tools that work for you related to art therapy and the Rosebud, and you mentioned the journaling, the way that you have a lot of different techniques to use. So that's awesome. That's really, really cool. And not everything works the same way for different people. So each person, through their own experiences, are going to find different things that work well for them. For some, it might be art. Some, it might be being outside, fishing, whatever it might be. That there are different things. So that's one thing that I think is really, really awesome that you're doing. AI is the future, and I think the majority of the population is can sweat over whether or not they'll be replaced at some point. I think it's great. I mean, like mental health is so important, and there are a number of challenges to people being mentally healthy, and the challenges rise. So too should the tools and the resources to match up with them. So anything that can be used would be great. And technology has done enough to destroy people's mental health. It's about time it helps, in the opposite way. With my personal experience, yes, it's definitely a challenge, and it's a double-edged sword. With I'm so thankful I have the knowledge, and I was able to respond to my daughter's illness with coming from the perspective of understanding, and I actually worked in the same healthcare system where we received care, so that gave me a lot of knowledge that I was thankful for. And I don't work with kids. I think if I'd worked with kids, that might be a little bit harder. So yeah, just kind of a double-edged sword. But thank you for your questions and your insights.
All right, Sissy?
Yes, I have a question. I've seen the anxiety and the depression, but what do you think about the post-traumatic stress by dealing with the doctors that all of us is like high percentages, like I think that we've all dealt with that, and the post-traumatic stress that is intertwined with that. And that's not really added in most of these studies, that particular, but the depression and anxiety is.
So I just want to make sure I understand your question. So are you talking about the post-traumatic stress within the relationship with the doctor?
Yes.
Yes.
I'm not, okay.
That relationship, dealing with the doctor-patient relationship.
Right. Yeah. So that's why I wanted to make, thank you for that. And I do think that is such a powerful X factor, the relationship with a provider. And there's doctors that do a really, really good job with that, and some that might be a little bit more old school where they're the expert and they're giving you the information and just want you to take the information that they have. And that is very, when you talk about feeling invalidated and not seen, that does really, intensify that. And especially if you know something's not right and you're trying to get a response and you're trying to get, some feedback, and doctors are incredibly busy. They, especially in primary care, I think in specialties too, they're just swamped. So so the both the effect that it has on the quality of outcomes and the effect that it has on a person's mental health are both highly problematic. And that's why I wanted to emphasize that idea of pulling back and trying to focus and formulate on what tack you want to take and what your specific biggest problem is, and either returning back to your doctor with, this is the problem I'd like resolution with, and with the mindset that if you at all have any option to go beyond your doctor, your doctor might be great for some things. They might be able to refer, they might be responsive with referrals. They might, if you have a cold, they might be great for that. But for this, it might be a stepwise progression where communicating with them that this is an area of concern, and if you're not getting that addressed, that you want to continue on with somebody else who can address what it is that's going on with you. And it's not a personal thing. It's not against the doctor. It's for you. It's for your health. So so yes to all the above, and that's my recommendation, is just to be very, try to be as direct as possible with your doctor, and if they cannot help you and you're able to, work with somebody else to find a fit that's better for you.
All right. Did you have one more? Just one more? Or you're done?
Oh, no, I have a couple. But
Just
one more? Okay, Patty's limiting me now. Let me see which one sounds more, well, the one's real quick, so I'm going to do
go
both.
ahead.
Okay, so the ones that add are things that you mentioned, like hypnotherapy. Are these types of things usually covered by insurance? I thought it was good.
I think so. I mean, a lot of it depends on the individual provider, but they're not all the specialty areas that I mentioned. They're techniques that would be performed, or disciplines that are performed by people who are licensed either as a psychologist or a clinical social worker. So that's the degree that they're working under, and that's where they're licensed through. And that's all the insurance company cares about, is that your provider is licensed. So if they're an approved provider and they're credentialed through your specific insurance, then it shouldn't be a problem. And it wouldn't matter what kind of therapist they are, if they're a rehab psychologist or a health psychologist, or somebody who is trained in EMDR and they're a licensed clinical social worker. As long as they're licensed and your insurance and they're credentialed through your insurance, then it shouldn't be a problem.
Okay, and the other question was sort of related. Do you recommend seeing a therapist for these types of things, or should we be seeing a psychologist?
I don't have any strong preferences. I think a lot of it comes down to where you live and what professionals you have locally. If you're in a larger city, you should have, most larger cities have health psychologists or rehab psychologists. And again, that'd be kind of a shortcut to getting to somebody who will understand the health part of it and work often with that. And they might have a good working relationship with physicians or other professionals who you might be interacting with, and they could do some coordination of care. So there's definitely some advantages to that. But I'm not dogmatic about psychologist versus clinical social worker or other type. I'd say, good fit and accessibility are the top two items in my book.
Okay.
Okay, all right, let's give it up for Dr. Webb. Thank you so much.